Thank you very much, Paolo. Thank you very much, UEHP, Reliance, for the invitation. It is really an honor to be here in this round, because it is not a presentation. I feel it more than an exchange of best practice today. Yes, effectively, I want to talk about our subject from the day, the future of healthcare. The future of healthcare is a hospital without walls. I have found this picture last week when I prepared the presentation in LinkedIn. So it is really the topic, and it has been published by Value-Based Healthcare. So also a topic we have a lot discussed today. But unfortunately, I have to talk you about the coal mine of the healthcare sector, the procurement. And the difficulties to put it all a little bit into practice. So I'm representing Mercure Hosp. Mercure Hosp is a public procurement body belonging to the hospitals of the French-speaking part of Belgium. It is an initiative of the hospitals because there exists no one in Belgium who has organize the procurement on a legal level like in France, or in a political level like in other countries, in Portugal. So we are our own boss, and this had a lot of advantages, but also a lot of defects, in the sense that we have to develop all by ourselves. We are mutualization. I've said it, the owner are the hospitals. And we have started as a reaction to the European tender law published in 2013. The first years we have simply done consumables, and afterwards we started with medicines and so on. And I am there since 5 years now, and I must say that I have really lived a lot of defeats. The idea of joint cross-border procurement, to say, okay, we are facing an industry who is globally organized, but buying Dafalgan in Germany or in Belgium or in Portugal or in Cyprus is the same. And the price is quite different between the countries. But there's no possibility to buy to price conditions of the other countries. And Belgium, you must say, that is a high price country, so we have to work. The problem is also the benchmarks, what is inside of this price. The price is not an economic price, a selling price, a market price. I'm an economist, so for me, the sum of all the costs plus the benefit is the selling price, and when it's too expensive, I have to organize it more efficiently or to reduce my benefit margin. But in our sector, the price is a negotiation between the insurers and the industry and the public institutions. And there is no legislation in our country for the healthcare procurement, so it is quite difficult. But we have had a lot of successes, because we have created in Belgium an ecosystem. We have a quite great exchange of best practice, even between our Flemish colleagues, what is a challenge in our country. And we have more and more acceptance on politics side by the legal responsibilities by a lot of people, hospital members and no members. So let's try to go to from the past via the present to the future. I want to explain you a little bit, as the example from Mercure Hosp, where we are living in the procurement. The procurement has started with simple things, make tender with simple things, consumables. And afterwards, I have explained it, we have started with pharma and the first relationship with experts in the hospitals, the pharmacists, and then for the medical devices, the doctors. And the lessons learned of COVID has learned us to open our tenders to a lot of other criteria than only the criteria of price and of quality. There are the criteria on sustainability, the criteria of value-based healthcare, and I want really to link the value-based healthcare to the patient experience, because when we are talking about outcome. We have to talk about total cost of ownership. When we talk about total cost of ownership, we have to talk about what is the feeling, what are the personal investments of the patient in all this healthcare discussion. The value calculation don't stop when the people is leaving the hospital. The supply chain versus strategic stocks, all this has to be implemented in tenders. In the meantime, the big discussion about data management, we have a strong relationship with Nuno on this topic. And the risk management, we are discussing with our colleagues from Reliance and the insurers in our country. And then the discussion about benchmark, because you know that every chief procurer in a hospital is king in his own kingdom. And a hospital is a regional organization. And when we are starting a tender, the first thing they are saying to us, we have the best price, we have the best conditions. It is all we have it. And then inside of our small structure, we are doing a benchmark, and then we see in Charleroi different prices than in Liège, and so on and so on. And then you see, I know in Pip, but when they ask them, you say, yeah, but he has said to me, the sales guy has said to me, I have the best prices, but say it to nobody else. Always the same. Voila. This is a little bit where we are working, and now, and we have discussed the whole day. We are since 2022, 2023, starting in this. We in Belgium, in Portugal might earlier, but we are talking about the artificial intelligence, and also related to this, the innovation discussion. Why? Because in our structure, our hospitals have at least understood that the procurement is the entry port for innovation. It's the link with the industry. And the industry is not like in the 20th century, who are our counterpart, our battle we are staging against. No. It is our partner, and we have to work together in a legal, clear framework, but they have ideas, and we have the patient, and we have the structure, and I think there is a lot of things, but I will come back on this afterwards. So, in the last 5 years, Merck Hosp, independently on the fact that we have no legal basis in Belgium, we have created a great ecosystem with political decision makers, with the Flemish part of our country, with a lot of players in the ecosystem, but also, and this was already my priority topic the last 5 years, on a European level, because the European tender law is a European law. And again, the application is the same in 27 different countries, and the industry where we are buying is a globalized industry, and to see it only on a national level is too short. And that's why I put from here the EPA logo besides the Merck Hosp logo, because I find it is really a great opportunity to work together with the colleagues from a lot of different countries to exchange best practice and to define at least the experience we share between all these different associations to put it internally in my daily business. The tenders are becoming meeting points, engagements about transparency, and we give them a legal framework. The only system of buying by shake hands is something, and we have seen it in the last 2 years with the price increasing, with the shortages, and so on and so on. If you have a legal framework, you have a legal framework in the sense of there are two parts who have obligations to move forward. And every stakeholder in the health system is implemented in a tender. We discuss with the doctor, we discuss with the manager, we discuss with the technician independently of the topic from the tender. And my great idea and what I defend in our culture, that it's not Merke Host who are the professionals. The professionals are inside of the hospitals, and for all tender, we ask for at least one expert per institution to participate in the content to the tender. And so the tender, the content of the tender, at the end of the day, is what the hospitals want to have, and we met us before with the industry, we have discussions before, we make tests and so on and so on, that it is really an agreement at the end of the day. So what about healthcare procurement and innovation? You have heard it, I'm a fan of tenders. And I am a fan because of the transparency, and a fan of the transparent logistics, and to uncover the supply chain defenses. But what I see in my daily business, there is inside of the hospitals, to be really honest, in Belgium, a lack of professionalization for the procurement part. There is no training activities for buyers. Buyers are people, nurse or ex-nurse, who don't want to make shift work, and they are maybe technicians and so on, and they start to do it, or maybe people who are coming from the legal account, but there's no real training, basic training for procurement in our sector. And to be honest, there is no team spirit. We have had, this was our big challenge the last 5-10 years, to create between the hospitals a team spirit. Again, they are not interested what happens in other hospitals. So we are in a healthcare continuum. COVID-19 pandemic has showed us the interdependencies in a larger ecosystem. And Annika, I picked something from you, but I find it great. And we must put out of our head that hospital procurement has a limit, or is limited in the inpatient activity. We have to procure inpatient and outpatient, but we have big problems inside Belgium too, that people who are leaving the hospitals don't or can't reach the medicines, can't reach the devices they have in the hospitals, because there are agreements and they are legal obstacles and so on. So we are working, and I come more and more in the innovation discussion. We are working with the stakeholders on the development, on the opening of our activity to the whole ecosystem. So my dream is that I want that the procurement is represented on the C-level. In Belgium, I know no hospital who has a CPO, a Chief Procurement Officer, who is absolutely well known in the car industry, in the chemistry industry, in the banking sector, and so on and so on. In our sector, it doesn't exist. It's represented by the CFO, COO. I don't know what, it is always filtered. But we have to move it forward, because again, it is the entry port for innovation. But the problem is that the procurer is informed, and the procurer has no idea how to place it in the structure. And I was very happy, my colleague from Lush Saudi has talked about a chief innovation officer inside of their structure. There's a lot of hospitals who don't have an innovation part, or an innovation counterpart, and this is really difficult for the industry. In addition to that, I want to talk to you about a European project, because the consolidation and the communication between the European countries is very limited. And I have really understood that we need European projects where we make, on top of EPA, people together, and we have one project, and we work together on this project to make the situation better, to make the transparency greater, and so on and so on. And I want to talk you 2 minutes about innovation, because for me, again, the entry port, but we are living in Belgium, in every case, a lot of innovation engagements we are doing, but at the end of the day, the innovation is not adopted in the structures. All is done. The budgets are there, all is introduced, but it is not applied at the end of the day. And it's a waste of time, it's a waste of money, and it's a waste of motivation inside of the structure. And that's where we are working on this European project Procure for Health, and I want really to share with us all here the reasons we have defined during our last meeting in November. And we have defined there are organizational reasons, leadership and commitment, governance problems, accountability problems, alignment problems. There are policy reasons, and there are human nature reasons. And what is the solution? The solution is meta-innovation. For me, I have definitely understood that we need to put all the people of the ecosystem around the table. Not only the people who are concerned by the buying activity, the people who are concerned by the application. And that's why I want to share with you this example. This example is a Flemish startup who has developed a software linking intelligent lighting, a nurse call system, alarm management, and real-time localization. The hospital directors agree on it. In Flandria, it is accepted. In Wallonia, not. But in Wallonia, the hospitals, my hospital, asked to make a tender for it. But we have used the tender to bring really the player of the ecosystem around the table. We have knocked on the door of the politics. We have not knocked on the door of the ministry of the agreement. We have knocked on the door of the different rest homes. We have knocked on the door on a lot of people, and we have put them together. And in little workshops, we moved together. This has taken time. This has cost money. But at the end of the day, it is the tender has been published in last autumn. And the tender was a success because it is now introduced in a lot of Wallonian institutions who has been not possible without our work. And this for me is a great example, and we have a lot of them where innovation, a proposal from the industry via procurement can be implemented in different hospital structures. And it is an added value as patient experience. And we have sold it as an added value for the employee experience and for the nurses. And with these two aspects, we have convinced the C-level of the hospitals, and we have convinced the collaborations inside of the hospitals to move forward. Voila. This for closing my presentation. So we are living in an ecosystem, and we have to think micro, meso, and macro in our procurement activity. We need time for innovation. We need also money for innovation. Professionalization of procurement versus the health continuum is something we have to move forward. We have really, inside of our tenders, more and more look to risk management and to patient experience, and we need more maturity and more training. And that is finally the menu for the next two years for Mercure Hosp I wanted to share with you. Thank you very much.